Okay, so it is a little after 5:30. We're going to try and get everybody out of here by about 9:30 this evening.
Yeah, right.
You're buying us some
Right, right. No, but
Okay.
in all seriousness, we have a lot of information to cover. I'm going to throw it out there. If it's too fast, you don't get it, raise your hand, interject, that's fine. We're all here to learn, okay? We're going to talk about some of the things that make our office different and how we attempt to support these type of thyroid conditions. So I'm Dr. Clark. I'm going to give you my introduction here in a little bit. Some of you are patients, some of you are not, but we've got a lot to cover. We'll try for an hour. If it goes over, it might be between an hour and 15 ballpark. So at least you know what to shoot for. I don't know if there's anything good on television tonight anyways. Idle? DVR it, right?
Yeah.
DVR it. Okay, so here we go. New solutions for thyroid problems and other chronic conditions. I'm what's called a board-certified functional neurologist. So a little bit about me, okay? Again, board-certified chiropractic neurologist with the Carrick Institute of Graduate Studies. I have over 450 hours in this. Then I'm going to be working towards my PhD. I'm a chiropractic physician. I have a Bachelor's of Science degree. I've been in private practice since '05. I've done a lot of mission work in different places, Trinidad and El Salvador. I'm fellowship trained in functional neurology. I'm fellowship trained in childhood developmental disorders through the author of this book, whose name is Robert Malello, the author of the book Disconnected Kids. So we do some work in here with kids that have autistic spectrum disorders, ADHD and learning disabilities, and dyslexia. Some groundbreaking, breakthrough stuff. He's also the developer of what's called brain balance centers. I don't know if you guys have ever heard of them, but it's basically learning centers around the country that basically focus on this and helping balance kids' brains, and he's seeing great changes with this. So again, it's brain balance centers. I've been trained in functional blood chemistry, functional endocrinology, functional neurotransmitters, chronic autoimmune conditions under Dr. Tatis Karazian, who is the author of this book. Why do I still have thyroid symptoms when my lab tests are normal? Buy this book. Very, very good information here. If you have a lot of these frustrations, you can probably relate to this. I'll pass this around for you. So basically, he's a leader in what we call functional nutrition. I work with Dr. Michael Johnson. I consult with him and thousands of other doctors. He's the author of the book, What Do I Do When the Pain Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. I'm the very first certified interactive metronome provider in the area. And I'll talk a little bit later about what interactive metronome is. We're the first people in the area to do that. I'm a member of the International Association of Functional Neurology and Rehabilitation. I'm currently working towards my CCSP certification with Dr. Moreau, who is the physician for the United States Olympic team. So basically it's a sports physician doctor. And I'm the only doctor in the area that's certified through the Spine Research Institute of San Diego in whiplash and brain traumatology. So I'm a whiplash specialist. So I spend a lot of money on continuing education, improving myself, trying to become a better doctor. This is what I do with my time to help chronic cases. So you're probably sitting there this evening, and what does a chiropractor know about this kind of stuff? Well, that's what we're going to talk about here. We're going to try and break this down for you and make it a little bit better to understand. Again, here's the name of the book. Buy this book. This is directly out of his book, but basically every cell in the body has a receptor site for thyroid hormones. These hormones are responsible for the most basic and fundamental aspects of physiology, basic metabolic rate. The lack of these thyroid hormones leads to global decline in cellular function of all body systems. The thyroid is a central gear in the complex web of metabolism and extremely sensitive to minor imbalances in other areas of physiology. Okay, so you guys get the idea. It has a lot to do with a lot of things in your system. And what we're going to try and explain tonight, this evening, is when the thyroid is going wrong, we have to ask ourselves, why is there a problem with the thyroid gland? And oftentimes it's not the thyroid gland that's a problem. It's an other area in the body that's attacking the thyroid that's making things worse. Or there's some things that are occurring that you're not getting enough thyroid hormone out for other reasons. And we'll explain that here after a bit. So again, USA health statistics. 1 in 2 are going to die from heart disease. 50% are going to develop some form of cancer. 1 in 3 will develop diabetes. In fact, by the year 2050, 1 in 3 children will become diabetic, which is a pretty staggering number. This is what we're doing to ourselves, okay? With all the processed garbage we're eating and all the refined sugar, all our kids are starting to become diabetic. 1 in 8 women have a thyroid problem. These are all chronic diseases and we've never been sicker. The World Health Organization basically says that over 100 healthcare systems of all the major industrialized countries in the world, we rank #1 in crisis care. So if you're in an accident, something negative happens, go into the emergency room, we are the best. We're the best at that. But here's the bad news. In 1997, we were 34th in overall health care. And as you can see through the years, we've actually gotten worse and worse. In 2009, we ranked 50th. We ranked 41 in life expectancy. We spend more money than any other country on health care, yet we have awful health. Okay, something doesn't add up. We have to start taking initiative. We have to start taking responsibility for our own actions and understanding what's going on with our body. So when a plant is wilting, what's the first thing you think of? It needs more water, right? Maybe a little bit better light, things like that. Maybe some more nutrients. But when you think about a wilting human, the first thing we often think about is what kind of drug do they need to get better? Okay, that's how we've been so changed over our course of our lives to think, okay, the pharmaceutical industry has just educated us that we need a drug for every pill or a potion for every sickness or ill that we have. So again, people that have a bad thyroid basically are told that, you know, this is what's going on, you're going to need this the rest of your life. That's what's happening. So all these chronic health conditions, whether it's a thyroid problem, fibromyalgia, vertigo, chronic fatigue, peripheral neuropathy, rheumatoid arthritis, migraines, ADD, ADHD, autism spectrum, all these things have something in common. It means there's some kind of deficit with some kind of thing over in here, whether it's an oxygen issue, whether it's a vitamin D imbalance, a metabolic issues, which is very common, we see that, a neurological issue, a dysglycemia or a blood sugar problem. So it's not one thing. There's a whole bunch of things at play here, and this is what's contributing to these chronic health conditions. So again, chronic conditions are a combination of neurological things, metabolic things. It depends on the case for each individual. So back to what we do in here, again, functional neurology. What a functional neurologist is this. Basically, if a patient comes into my office that has vertigo, okay, and they've already been to maybe their medical neurologist is going to prescribe something that's going to be an antivert, okay, maybe something like meclizine. I'm going to analyze them from a functional perspective, see what part of their vestibular system or balance system is not working properly, and base my exercises off of that. Does that make sense? So that's kind of how we differ. And we focus on the patients in our office are kind of, I don't know, medical misfits. They've been to other people and they just kind of keep falling through the cracks. There's nothing that shows up on the MRI, yet they know something is wrong. And you can see it when you examine them as well, but they never get figured out. So every cell in your body has a thyroid receptor, and it's responsible for a whole bunch of things. Again, I'm not going to read all these to you, but you can see. From bone metabolism to liver and gallbladder, all these things have thyroid receptors. So they're located out throughout our body. Who feels like this? You better not feel like this already. We're just getting started. We've got a lot to cover. Okay, so why good thyroid health is so important? Basically, the conventional approach has been long to treat the thyroid so that other systems it affects will normalize also. And that actually may be beneficial if, in fact, thyroid hormones are needed. And they're not always needed. Okay? And some people still feel lousy even though they're still within the normal TSH range. And we're going to talk about why that is. So again, some of the functions that come out of the gland's influence: bone metabolism, stores calcitonin, a calcium regulating hormone, gastrointestinal function. When our GI system slows down, we become more constipated, okay? Things get backed up, more bad bacteria can develop, we can have parasites. That's when things can start affecting the gut. The thyroid has a lot to do with regulating that. Gut infections from yeast and bacteria, again, poor nutrition and food intolerance. Has to do with male reproduction. You can get a diminished sex drive because your thyroid is low. That's going to affect your testosterone as well. Liver and gallbladder, again, we're slowing down the GI system. If things slow down, you get a sluggish liver as well. These toxins are able to build up in the body. This can cause problems. If you have a slow metabolism, again, the thyroid's going to affect that. You can't lose weight even though you've been on the treadmill all the time and you're logging all these hours. And you're restricting your diet and you're doing this, but yet the weight doesn't seem to budge. Why? The thyroid is a metabolism thing that goes on in our body that controls that. Who knows what the adrenals are?
They're on your kidneys.
Yeah, anybody. They're on your kidney. What do they do?
They do cortisol. Is it cortisol?
Yeah, that's right.
My sister has Addison's disease.
Yes,
Yeah.
so you know, yeah. So basically the adrenal gland is the gland that sits above your kidneys, okay? Does a bunch of things. One of the things is our stress gland, okay? So when we're stressed, it basically releases cortisol into the bloodstream. Okay? Cortisol has a bunch of different things that it does. Another thing that the adrenal gland does is it basically helps us with sugar regulation as well. So when you're sleeping, in order to keep you asleep during the evening, your blood sugar is dropping like this. The adrenal gland helps secrete basically sugar breakdown. Is what it tells the liver to start breaking down some sugar so you bring that blood sugar back up and you stay asleep. Okay? This is also what we call a sympathetically mediated gland. So there's really two basic parts of the nervous system. You have a parasympathetic and a sympathetic. Okay? The parasympathetic is our resting part of our nervous system, whereas the sympathetic part of our nervous system is our fight or flight. Okay? So when I'm walking in the woods and I see a bear, I've got two options. I'm either going to fight or I'm going to run. Okay? And that's the part of our nervous system that turns on when that takes place. So you don't have to be fast to outrun a bear. You just have to be faster than the person you're with. That's funny, folks. Come on. All right. So anyways, think about this just from what makes sense standpoint. Do you think it is healthy for that stress part of your body to be turned on long term?
No.
No.
Absolutely not. It's there for short bursts. So when we're constantly drinking caffeinated things, we're constantly under stress, whether it's through thyroid, gut infections, whatever it is, and that adrenal gland just keeps pumping and pumping and pumping. This constitutes the patients I see in my office that come in with fibromyalgia because this adrenal gland has just been so fatigued over time. This has an effect on thyroid hormone. Okay? You guys with me so far? All right. So again, when we have those adrenals supporting that cortisol, the cortisol is very toxic to an area in the brain called the parahippocampus, which is a memory area deep inside the temporal lobe. So when it bathes those receptors in there, that's what you get a lot of that brain fog or that inability to focus or things like that. That's what's happening. That's one of the reasons that caused that fibro fog or that brain fog we're talking about. And again, this obviously has to do with weight gain as well. And then you feel like this woman here. Okay, so just more stuff than how the thyroid affects. Adrenal glands compensate for low energy, adrenal fatigue occurs, blood sugar spikes are the #1 cause of physiological body stressors. So we have things that are called hypoglycemia symptoms. We have things that are called insulin resistant symptoms. What are the differences? Okay, hypoglycemia, hypo means low, glycemia is sugar. Okay, people that have what we call reactive hypoglycemia usually run a little bit lower sugar. Okay, these are the people that usually skip breakfast. They rely on things like coffee to keep them going during the day. When they do get something to eat, because they're lightheaded and they can't stand it anymore, usually they'll break down and just grab whatever they can get their hands on, whether it's a Snickers or a soda or whatever, just to get that sugar up right away. Okay, so that's not good. Whereas the opposite isn't good either. If we have higher sugar, we develop what we call insulin resistance. Insulin resistance ultimately leads to diabetes. Okay, so we should be here. If we have hypoglycemia, we're here. Insulin resistance is here. Diabetes is here. You follow me? All these are forms of dysglycemia or abnormal blood sugar. Okay, so again, the people that have insulin resistance usually are tired after they eat. Okay, that's part of the reason they're sluggish. They're a little on the heavier side because they've got issues with basically insulin production and how they store their sugar. So thyroid and cholesterol, again, if we increase our triglycerides, our cholesterol, or LDL, we're going to have too much fat because we're basically unable to process it quick enough. It's not being burned before it's coming through the system because thyroid affects that. Estrogen metabolism in breast cancer. Thyroid dysfunction hinders estrogen to estradiol, causing proliferative estrogen leading to breast cancer, uterine fibroids, and ovarian cysts. So in other words, when the thyroid is not working right, estrogen can't break down properly, and we have excess estrogen, which leads to these kind of things. Yes? Not very nice. Okay, stomach acid production. If we affect how the bowels process and how the stomach, the metabolism is affected, we have a decrease in what we call hydrochloric acid production. So hydrochloric acid is secreted to help break down our foods. When we don't have that going on, this is when we get these symptoms. That's going to affect vitamin B12 absorption. Vitamin B12 absorption is important for what?
Energy.
Energy, nerves. Big thing with this is nerves, okay? Vitamin B12. In fact, people that are on metformin, glucophage, It affects your vitamin B12. It's killing your vitamin B12. This is another one of the reasons that people get neuropathy that are diabetic, in addition to the blood sugar being affecting it as well. Protein metabolism, again, we have a decrease in HCl or hydrochloric acid. We can't break down the proteins properly, so we're going to end up with more of this heartburn, bloating, and gas type stuff. The thyroid maintains your body temperature. You might be perimenopausal. We don't know unless you do the testing. Okay, it could be possibly an adrenal gland dysfunction. It could be coming from your thyroid. Decreased progesterone leads to decreased what we call TPO activity and a decreased T4. So another one's basically what they're saying is how the hormones are affected affects how your thyroid works. This raises the risk of infertility and miscarriage. That's the main thing you guys need to know about that one. So that's what we just said. Thyroid hormones and anemia. We talked about this already. If you have a reduced hydrochloric acid in the stomach, you can't absorb the B12 and folic acid, which are both B vitamins. You can lead to an anemia. Pernicious anemia is one type, an inability to absorb B12. Anemia just means you can't get oxygen to the cells. That's more or less what that means. Whether it's an iron anemia or a vitamin B12 anemia, there are all sorts of types of anemia, and this can address those. Decrease, a hypothyroid patient compromises the liver's ability to manage homocysteine. Homocysteine is a marker we can measure to see basically inflammatory what's going on in your body, and also what kind of shape your heart is in. If we have a high level of homocysteine, we know we have increased our risk of heart disease, dementia, and other neurodegenerative diseases, like Alzheimer's and Parkinson's. Those are neurodegenerative diseases. And then things like this happen as well.
Yeah.
She just doesn't look very happy. All right, so what I'm trying to get you guys to understand is the thyroid talks to all the systems. It's interlooped with all the systems. For us to just go and treat the thyroid without addressing other things that would be causing that, it doesn't make much sense. That's what I'm getting at. That's the main thing I want you to understand. So symptoms of thyroid dysfunction are a lot. Fatigue is a big one. Weight gain, even when you restrict your calories, even when you exercise all the time. Okay, depression, morning headaches that wear off as the day progresses. Infertility, we already said. Constipation, overly sensitive, temperature changes. You're hot 1 minute, you're freezing the next minute. Okay, these are signs of symptoms of thyroid dysfunction. Poor circulation, numbness in hands and feet. You get colds, bacterial problems a lot. Wounds don't heal well. Digestive issues. You need a lot of sleep. Hair might be dry or brittle or fall out. Lots of facial swelling, edema all over the body. So these are all symptoms of things not going right in the body. How many of you have been told that your lab tests were normal, yet you still feel like something's going on?
Yeah.
Okay, we're going to break this down. Okay, so basically, when you go to LabCorp or you go to the hospital or one of these places, they have what we call lab ranges. And lab ranges can vary from Harrisonburg to Waynesboro to Charlottesville. Okay, so for example, if you come in my office and your blood sugar is at, we'll say your blood sugar is at 70, and the range we get from the hospital says between 65 and 105 is normal. Okay, so here you're normal. But if you take that blood sugar and go down to Waynesboro or to UVA or something like that, and they say normal blood sugar is 70 or 75 to 100, that's a little different parameter. But all of a sudden you've driven 45 minutes and now you have abnormal blood sugar. That doesn't make a lot of sense. You get what I'm saying here? Mm-hmm. So those lab ranges can vary from where you are. And it does happen. I see my office all the time. They'll say, oh, my labs are normal. I'm like, okay, well that's different than what we got up here. It's still not normal. Okay, so lab ranges are very broad. We look at functional ranges. Ultimately, we know with certain tests we run, it should be in a certain range. Okay, so for the thyroid, it should be between 1.8 and 3.0. This is what's optimal for the thyroid. It's TSH. We're talking about TSH. 1.8 to 3.0. And we'll say these numbers again here in a little bit. This is exactly what I just said. So we have lab range up here, lab range down here. This is functional ranges, very narrow. You might start getting outside of these functional ranges and you start feeling symptoms, yet you're not going to have a diagnosed pathology until you get outside of the abnormal low values or high values or the lab ranges. Does that make sense? Yes? Okay, you're with me. All right. Okay, so you said my labs are normal, you must be depressed. This is something, actually, I had a thyroid case in here 3 months ago. Exact same thing. Doctor looked at her lab ranges. She's been a couple different people. She's feeling horrible. After her last child, she's gained like 40 pounds. She's low-calorie diet, exercising all the time, still can't lose the weight. Finally went to the doc. Well, you're going to give her basically some medication, some psychotropes is what he wanted to give her. She was depressed, antidepressants. So here's some normal ranges. Here's the traditional lab ranges here on the right. Here's what we look at. So when we look at your fasting glucose, which is after a 12 to 14-hour fast, this is where it needs to be. If you start getting beneath that 85, you're more that reactive hypoglycemia symptoms like we talked about. Okay? If you start creeping up above 100, you start developing more dysglycemia, or what we call insulin resistance. This is optimally where we need to be, because every cell in your body needs a steady, proper supply of glucose, sugar. TSH, we already said, 1.8 to 3.0. This is traditional lab ranges. You can see there's a lot more room for error here, 0.3 to 5.7. Cholesterol, 150 to 200. Triglycerides, you guys get the idea. Okay, they're different. Okay, ours are much more narrow. You don't need to know that. Okay, this is a good schematic here. This is kind of how things work. So we've got the hypothalamus that sits up in the brain. Okay, and what it tells the pituitary gland to do, it does TRH, which is thyroid releasing hormone. It tells the pituitary gland what to do, and the pituitary gland gets that information. It produces what we call TSH, which is thyroid stimulating hormone. This is what's on your lab test, the TSH. This is what they're checking. Okay, so TSH is produced. TPO occurs, thyroid peroxidase, and basically that thyroid gland shoots out two things. It shoots out T4 and T3. The majority, as you can see, being T4. Okay, the 7% here of T3, that's our active form. T4 is our inactive form. Okay, so what happens is this goes to different areas in the body through what's called the TBG, thyroid binding globulin. We call it our taxicab. It carries T3 and T4 through different areas of the body, like the liver, the intestinal tract, and other tissues. Like we said earlier, there's thyroid receptors all over the body. Okay, so our ultimate goal is to transport T4 and transfer it into T3, because that's our active form that we want. Okay, now here's how things can go wrong, and you guys get the idea. If we have issues with our gut, whether it's a parasite, whether it's we don't have good bacteria in our gut, whether we have an H. pylori infection, we're going to have difficulty transferring T4 into T3 in the gut if the environment's not good. So already we're losing a high percentage of our thyroid hormone if our gut function's off. Does that make sense? And if you just run a TSH, you'll never know that. Okay? This is huge. This is really a lot of the patients I see in here. That patient I just mentioned earlier, same kind of thing. We ran what we call a 2105 metametrics, which I'll talk about in a little bit. She had a bacterial infection and she had a parasite in her body. We cleared those out. 3 months, she lost 30 pounds. Okay? That was her problem. It was the gut. It wasn't a thyroid gland. It was her gut. So basically, once these things are transferred in the gut, it can go into the receptor site and then eventually into the cell. And you can see other things in here with the adrenal gland. These things can be involved with this as well, but they're all under the influence of the pituitary gland and ultimately the hypothalamus. These are areas up in the brain. So these are the 6 major thyroid patterns. Okay, we've got our primary hypothyroidism. You guys know what hypothyroidism, basically low thyroid, right? We've got our hypothyroidism secondary to hypopituitary. So in other words, slow thyroid secondary to a slow pituitary gland. Okay. Thyroid underconversion, T4 is not going to T3. Why is that? Thyroid overconversion, maybe we have too much T3, or we have a decreased TBG, thyroid binding globulin, or taxicab. Maybe we don't have enough taxicabs to transport it. All right? TBG elevation from contraceptives or hormone replacement therapy. So we have too many taxicabs, and this often happens for people that are on birth control. And the majority of young ladies and women have been on or are on this currently. This affects our thyroid gland. And then, of course, there's thyroid resistance. And the only way we can figure out which one you have is to have the proper test done. So what thyroid test does the Mayo Clinic recommend? We'll talk about that later. So the primary hypothyroidism. The gland gets lazy. The pituitary gland tries to kick in the pants by pumping extra TSH. That's when we get that back on that lab, that TSH is elevated. Thyroid stimulating hormone is elevated. okay? This is the only pattern of the 6 that might need hormone replacement. This is one of the 6. Hashimoto's may need it too. What is Hashimoto's?
Autoimmune.
Thyroid you. What does that mean?
Thyroid disease. When your body attacks your thyroid.
Yeah, your body's attacking
Or
itself.
an infection.
That's exactly right. Any autoimmune disease is basically the body attacking itself. Whether it's lupus, rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, you get the idea. The body is attacking its own tissue, okay? In this case, it's attacking the thyroid gland. That's what Hashimoto's is. So again, how we treat this, nutritional support if caught early can reverse the problem. We got to support T4 to T3 conversion with this. This is the main thing we need to do with this one. And if you're just checking TSH, you wouldn't know, because you got to look at other things as well. Hypothyroidism is secondary to pituitary hypofunction. So again, slow thyroid, secondary to a slow pituitary gland. So this is when that TSH gets below that 1.8. The first one was when it was above 3.0. Second one was when it's below that 1.8. Chronic stress fatigues the gland. Hormone pills have a lot to do with this. Creams with estrogen, postpartum depression, pregnancy fatigues the gland, and fluctuating insulin and glucose levels. So as we go through here, you're going to see that adrenal glands and blood sugar have a lot to do with all these we're talking about, because they go hand in hand. Again, adrenal gland and blood sugar regulation. Thyroid underconversion. The gland is making enough T4, but there's a decrease in conversion from T4 to the active form of T3. So we end up with low T3. So that 93% of T4 we talked about earlier isn't getting converted over to that T3, which is the usable form. That's not good. That's what this is causing here. Chronic adrenal stress can give problems like this. Chronic infection, gut infections, or inflammation. Okay, this is gut plays a role in here as well. If it can't convert it into T3 in the gut, that's a big problem. That's 20% of our thyroid hormones in the gut. This is often missed because low T3 doesn't affect TSH, only T4 does. T3 is rarely checked for with a blood test. Thyroid overconversion and decreased TBG or taxicab. We don't have enough of those taxicabs. Too much active T3 is made and is overwhelming the cells, or too little TBG, which means too much free T3. Okay, so we have too much of the T3, and we don't have enough taxicabs to basically transport it. Number one cause, insulin resistance, blood sugar, high blood sugar. That's what it is. The cells are not listening to insulin, so more insulin keeps getting secreted and secreted and secreted. So the cells have decreased receptor sensitivity. This increases testosterone levels in females, and this gives too much free T3 and too little TBG. Are you guys following me with this, or is this too fast and too much?
It's great.
You good?
Yeah.
Okay. Okay, so too much TBG in the blood and thus too little free T3. So this is like having way too many taxi cabs and not enough people to get in a taxi cab. And no one ever lets their person get out because there's just too many of them going running around. So oral contraceptives and estrogen replacement have a lot to do with this as well. So nutritionally, we need to get rid of the excess estrogen by supporting what we call the detoxification pathways in the liver. So supplements we use to basically help speed up that detoxification pathway. Thyroid resistance. The pituitary and the thyroid glands are absolutely fine and the hormone levels are good, but the hormones aren't getting into the cell. So if you look back and remember that schematic we had, at the very cellular site where it said it has to get the cell receptor to receive it, there's a problem at the receptor site is what this is saying. Okay? Chronic stress stimulates the adrenal gland. It produces too much cortisol, which causes the cell to be resistant to the thyroid hormones. Again, it goes back to adrenals, blood sugar. These are huge. Okay? So nutritionally what we do is we address the adrenal malfunction. Increase aerobic exercises. This is a schematic of the Mayo Clinic here, kind of how they handle things, and their ranges are very broad, but their primary things that they test for is going to be the TSH and the free T4, and that's about it. So now you can see why running just those two tests is not going to really tell you what's going on with the thyroid gland or the whole pathway. These are the things that need to be addressed, each depending on your case. TSH, total T4, free thyroxine index, free T4, T3 uptake, free T3, reverse T3, TPO and TBG antibodies. Let me skip, yeah, okay. TPO and TBG antibodies. The majority of my patients that come in here with a thyroid condition have never had these checked, okay? These tell us whether or not we have an autoimmune thyroid, like this young lady told us, okay? Now, ready? 90% ballpark of hypothyroid patients are Hashimoto's. Okay, the majority of these cases are autoimmune. And if you've never had a TPO or a TBG antibody checked, you don't know. Okay, it's not going to change basically the way your medical doctor treats you. He's going to still give you the Lavoxil or Synthroid to try and get your TSH in normal levels. But you have to address the autoimmune condition. This supersedes treating the thyroid, if you can catch what understand what I'm saying. We have to address your autoimmune condition first. Why is the body attacking itself? We'll get to that in a little bit. Okay. So again, TBG levels we can check as well, which is the taxicab. So like we just said, TSH, maybe T3, or maybe free T4 and TPO. This is kind of what they're checking at most places. Okay. If this is all that you've done, you're missing important pieces of the puzzle. So your treatment's basically based off of that limited information. We just said this. 90% of thyroid problems are actually autoimmune disorder. Hashimoto's and Graves' disease. Okay, Graves is the other spectrum. Your immune system is mistakenly attacking your thyroid. So you have to run these tests. Not a thyroid problem. There's an imbalance in your immune system that needs to be addressed. The only way to find out is proper testing. So when do you suspect this autoimmune thyroid? When you have symptoms of hyperthyroidism. And when you also have mixed symptoms of hyper and hypothyroidism. When you have those symptoms that wax and wane. Sometimes these are the people who walk in my office and have a boatload of supplements they take. None of them ever help them. Okay, that's usually an autoimmune case. When these symptoms wax and wane, this has a lot to do when you can suspect an AI thyroid. Especially if you have elevated TSH. You constantly need to increase your thyroid hormones. So again, if your thyroid was removed, you could still have been AI before that or autoimmune before that, but now you have symptoms. And just because you took your thyroid gland away doesn't mean you fixed your autoimmune condition. You still are autoimmune. It can be affecting other areas. It can be affecting other areas. So 60% of Hashimoto's have other organs, just what I just said, being attacked by their immune system. So it can be affecting your pancreas, which is affecting diabetes. It can affect the myelin sheath. Myelin sheath is the covering of your nerves. That leads to things like multiple sclerosis. It can be affecting your intestines, like Crohn's and irritable bowel syndrome. Joints, rheumatoid arthritis, uterus, endometriosis, pernicious anemia, spine, ankylosing spondylitis. These are all autoimmune conditions, okay? And 50 to 60% of Hashimoto's have other organs being attacked by their immune system. So if we take out the thyroid gland, guess what? Chances are good it's still attacking somewhere else. Okay. So why would your immune system do this? Two reasons, okay? Dysregulation or an active antigen. A dysregulation is basically meaning the system is just imbalanced. Things aren't right, whether it's adrenals, whether it's blood sugar. Something's going wrong. Hormone imbalances, neurological imbalances, chronic inflammation from chronic gut issues, parasite issues. We don't know, but basically that's what we call a dysregulation. The parasite goes on this side. Active antigen is there's an immune system breakdown because something's invaded this, and that's what's imbalanced things. So think of it like a teeter-totter. Okay, we have two branches to our immune system. We have what's called our Th1, and we have our Th2. And different things are stimulated by different areas of the body. So what happens is sometimes these things get out of balance. Kind of like the heavy kid gut on one end and the light kid gut on the other end. Okay, so we have to learn and figure out why these things are out of balance and balance them back out. Because if it's chronically like this, you're going to chronically have ill health. So again, active antigens are these kind of things, whether it's a gluten or a soy sensitivity, which is very, very common. Okay, this is one of the big things that Dr. Karazi in his book talks about is wheat sensitivity. We know what gluten is, other than you. And you.
Okay.
No. Okay. Gluten is the molecule that's found in wheat, barley, and rye. Okay. Since the 40s, we've changed how we process our grains. Okay. And because of that, we're starting to develop genetic abnormalities. And people are starting to become more insensitive to these products. What this does and why this is very important is because this, if you have an autoimmune condition, this is like throwing gasoline on the fire. This makes these things worse, okay? Particularly with thyroid hormone, it's very similar to T3, okay? Gluten is very similar to T3, so it encourages that body to keep attacking that thyroid gland when you consume this stuff. This is huge, okay? And roughly 80% of people of European descent have a sensitivity. Some very bad, some not as bad, but it's sensitive nonetheless. Okay? If you're autoimmune, you need to get off of it. First thing you need to get off of. Now, how do you know if you have this? We got a test for it. The test that we run in here is usually done through what we call Lab, and we do a a swab of the mouth. It's like a DNA test. It's kind of like a CSI test. If you guys watch CSI. So they swab the inside of the mouth to see if you have the gene. Okay. And the second thing we do is we look at the immunoglobulins in the stool as it's passed out. So basically we can tell whether or not this gene's been activated or not if you have an active gluten sensitivity. So most people think of gluten sensitivity as celiac disease, which is true. That's one form. It's transglutaminase. But there's also another portion of gluten sensitivity as well. And also most people think that if I had a gluten problem, I'd have stomach pain every time I eat, which is absolutely not true. Okay? The British Medical Journal says that for every person that's diagnosed with celiac that has stomach pain, there's 8 other people walking around that don't have it because they didn't have it, but didn't know they have it because they don't have stomach pain. Do you follow me? So that's not a prerequisite to having gluten sensitivity. It affects thyroid, it affects different organ systems, it affects nerve patients. When we take care of neuropathy patients in here, that's one of the big things they all have is gluten sensitivity. So it's very important. If you haven't guessed by now, I'm trying to really emphasize that. Okay? Soy is another thing we look at as well. We look at dairy as well. These are all allergens that can really dysregulate the system more. The only way you got to know is you got to get a test done. Okay, so again, standard medical treatment is burning out the thyroid gland with hormone replacement therapy, which is basically based on a 50-year-old model. How can your doctor help you without having all the information? You need to look at the cause of the problem and not just managing the symptoms and not just try to get the TSH at a normal level, regardless of how you feel. What makes our office different? We look for the cause of the thyroid problem. That's the main things we focus on here with proper testing. We treat patients in here neurologically and metabolically. No stone is left unturned to determine the exact cause of your condition. So these are the things that we do in our office. We do a complete metabolic profile. We do complete thyroid profile. We look at the thyroid antibodies. We look at vitamin D levels. Who has their vitamin D checked before? Good. Good, you should. Vitamin D is very important if you have an autoimmune disease. Okay? We need to check for anemias as well, because if we're not getting oxygen to the cells, you're not going to heal properly. We need to look at the Th1 versus the Th2 imbalance, the seesaw, the teeter-totter we talked about. We need to do an adrenal stress test to see what's going on with that adrenal gland. So we take salivary tests 4 times throughout the day to measure what we call our cortisol rhythm. Okay? We look at food sensitivity testing. We talked about that already, whether it's the gene or through the stool. We do a stool microbial test. We look at for gut infections, parasite, leaky gut syndrome. You guys know what leaky gut is? It's actually really common too. You want to, anyone? Go ahead. Yeah. What is?
Well, it's when, is it also nutrients that can leak out from the intestinal wall? So your body isn't absorbing proper nutrients?
That's pretty much spot on. So what happens is in our intestinal tract, the cellular layers are like this. So they're tight enough that large molecules don't pass through. But when things are broken down small enough, they can be absorbed into the system. So through bad diet, antibiotics, things that break down our intestinal tract, infections, those junctions there just get looser. And they start getting looser, things trying to start to pass through that normally would not pass through. So the body recognizes that as a foreign invader and starts attacking it. And that also increases autoimmune is what that does. Okay, you're exactly right. So that's what we call leaky gut syndrome, which is a lot more common than you think. Okay, so again, thyroid interacts with all these different things. We kind of beat that over the head already. Adrenal stress test, we talked about already, looking at the adrenal hormones, including cortisol. Enterolab, to see if you got sensitivity to these kind of things. The only way to know is you have to do the test. And if you have this stuff, it's making your condition worse. It's that simple. Metametrics 2105, to see if you've got poor gut flora. There's a such thing as good bacteria. And we have good bacteria in our body for a reason to help us process these things. When we deplete our body of good bacteria, thyroid underconversion happens. We don't process food properly. Leaky gut occurs. That's what happens. Okay. Th1 and Th2 cytokines. So basically, we need to decrease the provocation of the immune system response, prevent progression of autoimmune and neurodegenerative process to other tissues. So treatment is basically made depending on what the lab tests reveal. We got to support your adrenals, stabilize your blood sugar, clear out your pathogens, repair the GI tract, detoxify the liver, eliminate provocative foods, address anemia, balance sex hormones, a little more intense than just giving you Levoxyl. Yes?
Yes.
Okay. And your symptoms may be able to be eliminated. You might be able to go off your thyroid medication. I will never tell my patient to do that. I don't prescribe medicine, and I don't tell patients to get off their medication. That's between you and your primary care physician. But if we can get you off some of the stuff, that's ideally what we were hoping for. You don't want to be on hormone replacement the rest of your life. You can lose weight, your hair can grow back, your mental fog can lift, and you can get your life back. These things can happen. So advanced treatment protocols for Hashimoto's. This is what we were talking about earlier. When we have an autoimmune condition, we need to remove that antigen and correct the dysregulation, or a combination of both, whatever it is. We need to get them, we check their vitamin D levels. We need to incorporate glutathione. What is glutathione? Glutathione is the most powerful antioxidant in your body. Okay? Basically, this helps repair damaged areas. Unfortunately, by the age of 20 per decade, after that, you lose about 15% of your own production every decade after that. Okay? So most of us in here aren't spring chickens anymore, are we?
Be careful who you're looking at.
I was looking at him. All right, so what I'm saying is there's ways we can increase our own glutathione production. Number one, exercise. That will help you make more of your own glutathione. You can't take a pill orally to make more. There's three ways to increase it. You can take it via IV, okay? You can do it via liposomal cream, which is what we use in here. You can do a suppository. Most people don't want to do that. You can also, see how good we get. Yeah, so those are the main ways to increase your own glutathione production. You can do it as a nebulizer too, actually breathing it in. But you can't actually take a pill, it doesn't get broken down properly in the system. So glutathione, we need to incorporate eating things like cabbage, Brazil nuts, having more selenium in your diet. Those things also help you produce more glutathione. Fish oils, very important. Fish oils are omega-3 fatty acids. We consume way too many omega-6 and omega-9s. Those are more plant oils, okay? Your ratio should be about 1 to 3, omega-3 to omega-6s. The standard American diet, or the SAD diet, is based about 1 to 20 or 1 to 30, with all the processed garbage we eat, okay? Those kind of oils, the 6 and 9, are inflammatory. They promote inflammation in the body. Omega-3s decreases inflammation. It's like a natural prednisone. That's what it is, okay? We need to remove the stimulus to the dominant half of the immune system and support the non-dominant half. We talked about that already, the Th1 and the Th2. We also utilize brain rejuvenation therapy, but proper testing is critical. Okay, so brain-based therapy, this is the neurological aspect of what we do in here. So what it is we're finding the weak areas of your brain that aren't working properly and stimulating them accordingly. Okay, so we have two halves of our hemisphere, left brain, right brain. Okay, some of us are walking around like this, others are like that. Depends on the situation. We need to fire the weak area of the cortex. Is more or less what we're doing here. So this is a typical example. As long as the cerebellum is receiving the proper amount of nerve input, there will be sufficient nerve input to the frontal lobes of the brain. That's a whole bunch of stuff, yeah? Okay, so the cerebellum is this guy back here in the back of the head. You guys have heard someone getting hit so hard that their bell gets rung, okay? That's our balance, that's our coordination. So when I make a coordinated movement like picking up the book, my cerebellum on the right helps fine-tune that motion for me. But it works real tightly in conjunction with my opposite side frontal lobe, which is this area up and through here. But when I lose proper stimulation in, when we're sedentary, we're not doing things properly, things start to decrease in size. So it's like if you don't use it, you lose it. And that's kind of what we're talking about here. So the brain can activate properly, the frontal lobes can activate properly. They can send messages back down to the lower part of the brainstem to keep this midbrain in check. The midbrain is that mesencephalic region, and it's tied in with the sympathetic part of our nervous system. Remember we talked about the stress part of our nervous system? That's located right in through here at the IML in the midbrain. Okay? So when this is working properly, and the frontal lobes are working properly, we can dampen that output of that area. That's what it's getting at. So a lot of kids we take care of don't have proper developed frontal lobes. We have to incorporate that into our activities. And that's one of the reasons that they have a lot of other systems going wrong, like wetting the bed or difficulty with balance and coordination, these kind of things, because their brain hasn't developed properly just yet. Is this too much? I think we're doing good on time. All right, we're doing all right. So if one side of that cerebellum is not working properly, as you can see, then information is not going to go to the other brain properly, so we can't keep things in check like we should. Okay. Newsweek magazine, there was an article in 2002 that talked about rewiring your gray matter. So what this basically means is the brain is not a plastic organ. Just like any other area in the body, it can be changed. We can strengthen it accordingly, and that's what this is talking about. And there's a gentleman that they talked about in here called his name is Dr. Edward Taub. And basically he has been working with people that have had strokes. And 20 years before seeing him, he was able to, or had the strokes 20 years ago, yet he's still able to get results with them and change some things with them. So for example, if we got a middle cerebral artery stroke on the left side, it's going to affect our right brain to do this. Okay? So years ago, they would just tell the patient to learn to use their left arm more. So what Dr. Taub is saying is, you know what, move that right arm. We're going to activate it, we're going to make it move. And you start sprouting new areas up and through here, and the connection gets better again. That's what he's talking about. This is called neuroplasticity.
What's his first name?
Taub, T-A-U-B, Edward, I have it here.
That's all right. I have it.
You got it?
Yep.
Okay. All right, so if you give a nerve what it needs to survive, which is fuel and activation, air that you breathe, oxygen, proper glucose, and you stimulate it, it can work properly and it can survive. It can become stronger. If you don't use it, you lose it. So how can this happen? Well, these are the things that can affect the decrease the frequency of firing of the brain, whether it's physical, actual injury, a car accident, whether it's emotional trauma, chronic stress will decrease different areas of the brain as well, or it can be a chemical issue, such as poor thyroid function. So why is this important to a thyroid patient? Well, in Dr. Karazing's book, he talks about this. The brain is saturated with thyroid receptors. Healthy thyroid function is integral to healthy brain function. Brain health and sufficiency of the neurotransmitters serotonin and dopamine are important for thyroid function. That's why it's very important for us to treat you neurologically as well. Do you guys know what a neurotransmitter is? It's basically the chemical that's sent between two nerves to tell it what to do. There's a whole bunch of them. Serotonin and dopamine are just two of them. Symptoms resulting from a disruption in the brain's electrical vitality, all this stuff in here. These are all negative things. Your brain's a living computer that runs every cell, organ, and tissue in your body. When it becomes imbalanced, abnormal impulses cause your body to malfunction. So part of our program, again, like I said, some of the things we do in here is to find out what area of the brain is not working part. Is it the frontal lobe? Is it the temporal lobe? Is it the parietal lobe? Is it cerebellum, occipital lobe? That's the things we need to look at.
Go back one, though. Go back one. Does it say anything about hearing?
Yeah, hearing's temporal lobe.
Okay.
Mm-hmm.
I don't see it there, though.
I can put 7 more slides and list a whole bunch more if you like. I mean, we can do that. All right. So is your brain shrinking? This is actually pretty interesting. Is your brain shrinking? Research at Northwestern University found that 1 year of chronic pain shrinks the brain by as much as 11%, which is equivalent to the amount of gray matter lost in 10 to 20 years of normal aging. I have patients come in my office that have chronic pain for 15, 20 years, and even more. Do you wonder why they can't remember things, they forget stuff, they can't focus? Their brain is just going, this is bad news. Okay, so the moral of the story is if you've got chronic pain, fix it. Symptoms of brain malfunction are all these things, and these are the things that we see in our office. Migraine headaches, okay, irritable bowel syndrome, high blood pressure. These are all symptoms of things not working properly. The fibro fog, like we talked about earlier. These are just more symptoms. Learning disabilities, problems with balance, more irritable or angry. Okay, so again, the brain requires 2 things in order to function properly: fuel, glucose and oxygen, activation, input from the 5 senses. Oxygen, again, there you go, there's a picture of an oxygen concentrator. These are different therapies we use for brain activation. We do a lot of visual exercises, eye exercises. You can do word searches, faces recognition, color recognition, caloric irrigation. You guys don't need to know this. Remotor stimulation, we take care of people that have peripheral neuropathy, stimulation of their feet. Interactive metronome, this is a pretty neat device. Basically what this does is helps remap the brain, rewire the brain. Okay, everyone knows what a metronome is, right? Keeps time. Okay, so what we do is whoever's utilizing the machine, whether it's kids that we use it for, or adults that have some issues going on, to retrain or focus on one area of the brain. It helps with all these things right in through here. Okay, so the individual sees a flashing light, hears a sound, and it's the same time as the metronome going off. And what they have to do is either tap a trigger on their hand or step on a trigger on their foot at the exact same time. If they're too fast, they'll get feedback. If they're too slow, they'll get feedback. It sounds very easy, but it's measured in milliseconds. Okay, so the stronger you get with your brain, your repetition, the better this thing challenges you. Okay, so it's really effective in treating these type of things. Non-surgical spinal decompression. This is a machine we use in our office that basically helps with chronic disc injuries or spinal problems. Okay, so we put all the pieces of this stuff together to figure out what's going on with you. And as you can see, we're going to look at cortisol, blood sugar, hormones. Is there oxygen issues? Is there cerebellar issues? Find the real cause of the problem, put the pieces together, and then we can obviously see that we got a completed pie right here. And then you're happy. Okay, so the key to health, get tested, find the cause of the problem, and correct it. These are the kind of cases that I work with as serious cases. Those are the ones that I like to work with, okay? On a scale of 1 to 10, I'm looking for 8, 9s, and 10s, and that's what this is getting at here. So be a lifesaver to someone. The rules for the people that I accept for cases, I don't take on smokers unless they're willing to quit. You got to be willing to make a lifestyle change, and you got to take personal responsibility for your health. You got to make the necessary dietary changes. So if we have to do things dietarily with you, that has to be done. If you're not willing to do those, I can't help you. It's not going to work. Let's not waste each other's time. This is what we do on the first 2 visits. You guys don't need to know that. Here's what you need to know. If you have questions following the presentation, email me, drclar@gmail.com. This is my website, on my thyroid site, harrisonburgthyroiddoc.com.
I'm sorry, give me your, oh, there it is.
drclar@gmail.com.
Is Hashimoto's reversible?
It's autoimmune. All you can do is turn down the volume. And oftentimes that's all you need to do. And then if you can get that accomplished, then that's what needs work on. But as far as reversible, the TPO or TBB antibodies showing up negative, difficult to do.
Dr. Clark,
Mm-hmm.
as you know, I have myasthenia gravis. I'm on websites all the time trying to find out about this. And the other day I hit on a website. It's Garvicel,
What is it?
Garvical.
Okay.
It consists of several different herbs. And it's guaranteed, and this is 90% positive, that within 4 to 6 weeks, you won't have myasthenia gravis anymore.
Okay. I've never heard of it. I don't know what's in it.
Can I email that article to you?
Absolutely. Yeah, I'd like to take a look at it. What questions you guys have? I try to do pretty well on time, so.